And hello there, it's noon, and that means it is time for our Facebook Live. And it's kind of a cornucopia of things to talk to you about. So I want to get started. I am your host, Dr. Polly Heil-Mealey with Abundant Health and Wellness, and we are located at 323 East Main Street in downtown Humble. So if you're in the area and you want to come and see me, that would be great. Otherwise, I'll see you in cyberspace. So lots of things. I'm making myself a note so I don't forget, because I want to talk to you about a lot of different things. So I've been doing a lot of research. First of all, behind me, right here, just touched it, right here, is my new microscope. And so I'm going to turn you a little bit so you can actually see. There it is. So we are studying live blood cell analysis, and I'm doing all that. And I have a picture. It's working. I'm doing some research on that, so hopefully we'll be able to offer this to you soon. But one of the things that I want to talk to you about is something called C-reactive protein. Now, on your blood work, it'll be called CRP. It may be called HSCRP, and this is a marker. It is an inflammatory marker in the blood, and so we want to kind of talk to you a little bit about that today. So I'm going to give you some research, and we're going to tell you what this means to you in real time, and then we're going to talk about some other things. So when your body undergoes periods of excessive inflammation, aka cellular energy, right, it produces a compound called CRP, C-reactive protein. It is caused by a lack of sleep. It is caused by stress, and it is caused by eating processed food. And so what this does is the body makes C-reactive protein. It floats in your bloodstream, and it helps you or makes you have chronic low-grade inflammation. So inflammation is the root of every sickness, every disease, whether we're talking about arthritis, we're talking about allergies, we're talking about autoimmune disease, any of that kind of thing. C-reactive protein is at the end of it. Why is this important? Because if we have low levels of CRP in the bloodstream, we are going to find it very, very difficult to lose weight. So as you know, we do offer a weight loss clinic here in house, and we're getting ready to do it online as well. So that's something you can be looking forward to. But the CRP, right, when the body has too much CRP, it has to spend a lot of its energy containing that, damping that down. And so when it does that, then the body's protective mechanisms slow your metabolism and increases your tendencies to store calories as fat. It also makes you really, really hungry. So I don't know if you have noticed that when you are running on stress, when you're running on sleepless nights, that you are more hungry, but that could be because of the C-reactive protein in the body. So excess body fat produces inflammatory compounds. So we've got the inflammation that is very, very low powered, and it causes us to gain weight, but it's that extra weight that actually increases the inflammation, and it's kind of a vicious cycle. So we need to know. I see people are chiming in. Hello. Thank you for joining. I hope you appreciate what we're talking about today. So people don't usually test for C-reactive protein because it mainly is contained or dealt with lifestyle changes, and doctors think that people are not going to change their lifestyle. So, why bother telling them about their C-reactive protein? But when you have these high levels of this substance in the body, then you've got these weight issues. Now, the C-reactive protein blood test does not actually identify the root cause of inflammation, but it shows us that inflammation is there. So what do we do about the inflammation? Well, we have to get all of the stress out of our life. So that's really hard because life is stressful sometimes. Life happens. I mean, we here at the clinic, we've had to have the air conditioning people out, I think, 4 or 5 or 6 times maybe in the last 2 weeks, and they're very good. It's just an old unit and there's a lot of things going on. That's stressful, right? We've had some other issues with the building. It's an old building. We knew that we were going to have some issues, but it's stress. There are all kinds of things. It's hot outside. You have a bad hair day when you go outside. So all of that is stress as well. And so we need to be able to release that stress. So how do we do that? Well, we can eat a plant-rich diet instead of a processed food. Now, this is something, especially with our moms, our single moms. I know we have a lot of single moms in the audience. I used to be a single mom when my husband died, and so I know that when you're a single mom and you only just have one income, then you tend to try and make that dollar last. And I'll tell you, with some embarrassment, but I didn't know any better, when I became a widow, I had 2 teenage children at home, and we ate at Cece's Pizza a lot. You know why? Because you could do all you could eat for $2 or $3 or whatever it was. And so I had growing children, and they ate a lot. And so I had to make my dollar go further. Of course, I didn't know anything about this. I had started studying holistic health as a hobby, but I had no idea how food would play a part in health. So for the single moms, I know it's very, very tempting to go through the dollar menu, to go to the all-you-can-eat for a set price, but really that just aids inflammation, and you're setting your children up for lifelong issues, because children that are obese tend to be children that grow into adults who have serious, serious autoimmune diseases, so we don't want to do that. So we need to watch what we eat. We need to watch and see, do we exercise daily? I know that should be a 4-letter word. Nobody likes to exercise, but when you exercise, you're moving your body, you're moving that lymph, and it's carrying those destructive molecules out of the body. What about sleep? Does anybody get 7 to 9 hours of sleep a night? Most people don't, especially our young people. We have a lot of teenagers that come in here, and they maybe get 5 hours or 6 hours, and they'll say, yeah, that's all I need. That's not all you need. That might be all you get, but if you don't have enough sleep, then you could be building this CRP in your body. And so we want to make sure that if you are having weight issues, that would be something that we can really deal with. And I left an email in my other office, so if anybody's listening in the front and they can come back and give me that would be great, because I really wanted to talk to you about something that's really exciting. But while I'm waiting for them and see if they're listening, because they don't usually listen to me, we'll see. Speaking of the CRP, we do have some specials going on with our blood work right now. So these are some really, really good specials. So men and women, these are hormone panels on your men. If you wanted to do a PSA, if you've not had a PSA done, prostate-specific antigen, you're over 50, you've not had this done in a while. They used to be $88 a test, and now they're only $44. If you wanted to see what your testosterone was, normally it was $160. They've reduced the price to $120, so that's something you can think about. A men's health panel, and what that is a comprehensive wellness panel, complete blood workup and that kind of thing, your analysis, CRP, and your hormones. So this is both men and women. This test used to be right at $400, and they have discounted it now to $250. So I think that's going to be for the next week or so. So if you need these blood tests, you want these blood tests, call and talk to Tracy or Trish, and they can help you with that. Now, I want to... they're not coming with my email, so I'll just tell you about this email. This is from a friend of mine, and I wanted to give it to you in her own words, but sadly, I left it somewhere else. But anyway, just long story short, she grew up in a very loving, godly home and had normal periods, 3 to 4 days, she said, with no problem whatsoever. She had children, and all of that changed. And she started having really hard periods, really heavy periods. And subsequent to that, she was diagnosed with depression. So the doctors went through all kinds of medicines and that kind of thing with depression. And she battled this for several years. I want to say 7 to 10 years. So that's a long time. Antidepressants, different things. And so 2 years ago, one of her friends noticed that she was eating ice all the time, just chewing on ice. And not only was she diagnosed with depression, postpartum depression, she was also diagnosed as ADD, ADHD, and bipolar. So these are quite a lot of different diseases to be diagnosed with. Anyway, her friend noticed that she was eating a lot of ice and had read somewhere that eating a lot of ice could be a symptom of iron deficiency. And yes, that is true. Eating a lot of ice is also a symptom of having a parasite infection. And so when people are anemic, that's the medical term for it, for low iron. When people are anemic, we ask, because we're holistic, why are you anemic? So you could be anemic because if you're a woman, you have a very heavy period, you have long days, lots of cramping, heavy flow for multiple days. That can make you anemic. Or if you have parasites. The parasites are sucking your blood, and that can make you anemic. So I digress here. The main part of this is that the symptoms of bipolar and depression and all that kind of thing are very, very similar to the symptoms of being anemic, being iron deficient. And so if this is you, and a lot of women out there are depressed, they've been diagnosed with depression, they've been diagnosed bipolar, they've been diagnosed all these different things, you might want to have your iron levels checked, because it could be just a very simple thing of eating iron-rich foods or taking an iron-rich supplement. Now, some people will say, well, I don't want to do iron because iron makes me constipated. Well, if it's inorganic, then yes, it will. But if it is an organic substance, then it won't make you constipated. And so she sent me this email a couple of weeks ago, and I wanted to share that with you, because there are a lot of women that are diagnosed with depression and bipolar and that kind of thing, and they may just be iron deficient. So there are liquid herbs that you can do to work with that. There's also, we've got a plant-based pill. You take one a day. It gives you 85 milligrams of elemental iron, and it's all in a plant-based formula, so you will not get constipated. So that's a good thing. So I want to tell you that. I want to tell you about, the blood work. So I want to tell you about some information that we have just compiled, and I have my little sheet right here on the O2 chair. Now, we kind of introduced you to the O2 chair last week. Trish was in it, and we showed you how that worked. And so we've been doing this for approximately 2 months with different subjects and that kind of thing. So I wanted just to show you what we were able to measure and why getting more oxygen in the system will help you. Now, we talked about CRP. One of the things I did not tell you is that if you have a high level of CRP in the blood, then you are more prone to cardiovascular events. Okay, so there's a direct correlation between how much CRP you have in the blood and your cardiovascular risk. Well, on our, I don't have it in here because somebody used it, on our HRV, I think I showed you that last week. The HRV is the heart rate variability monitor. Okay, that is a test that we do here in the clinic. There are about 9 different screens, and it shows you all kinds of things. But what I want to show you right here, right, is these little markers. Now, when this person started at, this was early March, all of their markers were between 60 and 80%, right? Optimal is 80 to 100. So this person is in a good place. But the cardiovascular adaptation went from 74% to 100%. The nervous system went from 65 to 99%. The hormonal regulation went from 70 to 90%. So these are all very, very good outcomes with using the O2 chair. Now, we measured the heart rate variability before we put her in the O2 chair, and then we measured it after the O2 chair. So went from the lowest number was 65, the highest number was 74. That increased over 2 months to almost 100% in every situation. That's really, really key. We had another participant, and this is very, very dramatic. Let me get my paper right here. Very, very dramatic here. Is it straight? When they started, it was at 1%. Almost everything was, well, everything was 1%. At the end of the trial, one marker was at 39%, but everything else was almost at 30%. So that is a huge, huge improvement just by doing the O2 chair. Now, all of these people that are in this particular study with me, they are my patients. They volunteered their time so that I could get this raw data, because I've been doing a lot of research on oxygen therapy, doing a lot of research, wanting to know, really, was it just a bunch of hype? Was it just, they have it in Las Vegas, so if you get a hangover, you can have some oxygen and it kind of clears your head and that kind of thing. So I wanted just to see, what does it really do to the biomarkers? And so I just want to kind of show you another one. Let me find it here. Here we go. This is another lady. She was all at 1%. And she, at the end of the trial, she was between 70 and 74% in all of her markers. So we tend to think that the older we get, the less adaptive we are. But I've just shown you 3 people over 60 and 2 over 70, right, who have had great, great change in just coming in and doing the oxygen chair. So what does that mean? If you didn't see the video last week, scroll down on Facebook and you can look at that video. And what that just means, you come into the clinic and you sit for 5 minutes, 10 minutes, 15 minutes, or 20 minutes. You've got 4 choices there in the O2 chair. All the people that were here, they did the 20-minute session. And it puts you in a zero gravity position. And there's heat on your back, so it's very, very comforting. We give you a blanket. And instead of breathing 20% oxygen, which is what normal atmospheric pressure is, then you are actually breathing 60% oxygen. So it's 3 times the amount of oxygen that you normally have in the atmosphere. So you can do this, like I say, from 5 to 20 minutes. And when you leave, of course, the longer you do it, the more you actually feel energized, you feel tingly, you feel relaxed, you feel rested. But this shows you that all of your markers, your cardiovascular marker, your neurohormonal marker, your central nervous system, your autonomic nervous system. Now, your autonomic nervous system, this is the part of the body that you have no control over. Well, they say you have no control over, but we've proved that when you do this oxygen therapy, that you increase the effectiveness of your autonomic nervous system. So your autonomic nervous system controls how you breathe, the chemicals you make in your body, whether you're making that CRP or not. It controls how your hormones are doing. It controls how you change your amino acids into enzymes. It controls your digestion. It controls how fast you blink your eye. It controls your heartbeat. It controls all these things, because we don't think about blinking. We don't think about our heart. We don't think about breathing until we stop, right? We get a shock and we catch our breath and that kind of thing. So this proves that by giving us more oxygen, we're able to make all the systems in our body work the way they need to. Now, this is a very, very expensive machine, but it's not expensive to use. So if you came in and you wanted to use this machine, it would be a $30 charge for you to come in and do this. And so why do I want you to do this? Because I want the $30? Well, yeah, everybody wants to make money, but this is the outcome. So when you're thinking about these patients, all of these are my patients. 2 of them started at a level 1 on heart rate variability. Now, what does that mean? The variability is the amount or the space of time between the R waves in your heart. You've got P waves, you've got S waves, you've got T waves, and you have R waves in your heart. So to test what your variability is, it is the number of nanoseconds between the R waves in your heart. So the more flexibility you have, the more adaptive you are, the higher your numbers are going to be and the longer your life is going to be, right? So if you have a score of 1, then your heart rate, when you look at it on the screen, it's just going to be static. It's just going to be just a straight line. All your beats, you're going to see your beats, but on the graph, it's just going to be straight. If you have a lot of variability, you're going to see that up and down, that wavy motion. And so what that means is there's just more variability in the heartbeats. And so you're going to be able to adapt to stress. You're going to be able to adapt to conditions that come your way, and you're going to be able to have lower CRP, and you're going to be able to have lower stress response, cortisol and that kind of thing, which is going to make everything else work that much better. So hope that this helps you. I mean, they say a picture is worth 1,000 words. This is amazing. Now, as a doctor, as a practitioner, I get way more information than just this. This is kind of a summary page, but I can look at all of your neural hormones and see how they're responding. I can look at all your minerals, see how they are responding. I can look at your endocrine system, how it is responding. And so there's just so much that I can see from the different screens on this HRV. So just want to encourage you to come down and look at that and see what it does for you. We'll do a HRV before and after, and you can see the changes that it makes. So now I want to get to the fun part. I've given you a lot of scholarly information, and so I want to give you a fun thing. So don't do this. Do not do this, but this is what's going around on the internet. So one of the things I like to do is to tell you what's true and what's not true. So what is going around on the internet? Well, they're saying, and this is for men and women, but probably more women, so if y'all are squeamish about sex things, then, whatever. They're saying that if you put Vicks VapoRub on the clitoris or on the penis, that you can have dynamic sex. Well, don't do it. Okay? We're just saying do not do that. Number one, once it gets there, you can't get it off, okay, because it's an oil base. You don't want to do that. Vicks VapoRub, if you don't know what it is, if you're in another country or whatever, and I know we've got watchers all over the place, if you're congested, you've got a cough, you can't breathe, you'll put Vicks VapoRub on your chest. It's a mentholated ointment. It's a cream. It's very kind of greasy, and you put it on your chest. You can put it, on the bottom of your lip, bottom of your nose, top of your lip, and it helps you breathe better, and all that is awesome. You get it too close to your eyes are going to tear and water because of the mentholated whatever they put in there, and it has its uses for that, but I definitely would not use it as intimate lubrication or anything like that, because what it does is it will set you on fire. Now, have I done this? Absolutely not. I'm smarter than that. I would not do that. But there are all kinds of personal lubricants that make you hot and all that kind of stuff. And so you want to be able to, while that might sound good in practice, it's just not so good and it's not healthy. It leads to messing up the microbiome in the vagina, and it causes all kinds of problems. What they're saying is, besides being great for your sex life, it also stops you having yeast infections. Some people call it candida, some people call it thrush. They're saying that the Vicks VapoRub stops that. Well, that is not true. It does not stop that. Karen is asking, is it good for toenail fungus? I have heard it is, but I have never seen it actually accomplish anything. So I think it's really only good for congestion. Certainly not going there. But I want to tell you a funny story. This happened to me in, it wasn't to me, but it happened when I was in college. And we lived in the sorority house. I lived in the sorority house. There were about 6 other girls down at the University of Houston. And it was in the Phi Slamma Jamma days, so it was a long time ago. And anyway, one of my roommates happened to she was very athletic, and she had some muscle cramps, and she was putting Bengay on her legs for her muscles. And what she did is she put the Bengay and she got up. She decided she needed to go take care of some personal monthly, things that we have to do. And she did not wash her hands before she took care of what she needed to take care of. And as a result, the Bengay that was on her hands was transferred to her tampon. And it wasn't but about 5 minutes later, and she is dancing all over the house because she's so uncomfortable because she has put Bengay unknowingly into her nether regions. And there's just no way to undo that. So I know from experience, as I say, not mine, but watching my roommate inadvertently do this with these type of products. And she was very, very miserable for quite a few hours. So please do not do that. It will not help with candida. It will not help with thrush. It will not help with yeast infections. All it's going to do is give everybody a dance party, and you won't be enjoying it, and there's no way you can really undo that. So just for what that's worth, I hope you kind of laugh a little bit after we talk about these other things, bipolar and CRP levels and inflammation and all that kind of stuff. So I know that someone asked earlier about tinnitus, and we can talk about that another day. So I will be doing some research on that. So thank you for listening. Thank you for watching. Summer is upon us. So that means certainly if you're down in the Gulf Coast region where we are, we have high, hot, humid days and not a lot of rain. So be careful, be good to yourself. Be sure you stay hydrated. Somebody asked earlier this week, what do we have? That would be a great substitute for Powerade or Gatorade for the heat. And we have two products. One is called Spectralite, and it is a ionic micro and macro mineral blend. You put a dropper of that in your water bottle and then rehydrate as well. It makes your water wetter, which means that the body absorbs it more, and so you're going to get more goodness out of it. So we recommend those two things for these dog days of summer, and we're not really even there yet. That comes in like August, but it is the summertime. It is hot. We're going to reach 100 degrees this weekend. So love you guys. Stay healthy. Stay hydrated, and I will see you next week. Thanks so much. Bye-bye.